Hi, so this is discussion 2 for week 3. Power is described as an action utilized by organizations to achieve certain goals and objectives of that specific organization. According to French and Raven's model of power, there are 5 bases of social power discussed. These 5 components include coercive power, legitimate power, referent power, expert power, and reward power. Coercive power is associated with a punishment if the recipient should not comply with the instructions given by that certain agent. Legitimate power is associated with social rank and loyalty. Cultural values actually impact legitimate power by respecting social rank and organizational hierarchy. 2 specific examples of these cultural values are the respect for elders and higher ranked individuals. Referent power is described as the recipient being influenced by the agent's personal charisma or motivation. Referent power is derived from the desire to please and respect the agent. Expert power relies on the actual knowledge required by the agent. The recipient is compliant because of the knowledge and information the agent holds. And number 5, reward power is associated with the recipient receiving an award as an incentive to comply with the agent's objectives or plans. Due to the unrealistic error-free environment in healthcare, the most beneficial sources of power are expert, referent, and reward power. Although these 5 different bases of social power may be utilized, healthcare organizations may also use structural power sources, and these include resource power, decision power, and information power. Resource power is associated with the resources needed for the organization. This type of power is derived more from the financial aspect. Decision power is derived from the level of authority one holds within the organization. I associate this type of power with scope of practice in healthcare. Information power is associated with agents having highly desired information that recipients want. A negative aspect in regards to types of power is the term power hungry. Some individuals feel superior to their staff once they obtain a certain amount of responsibility. The term team is no longer part of that organization with these individuals. Jealousy is also a negative aspect. Speaking in terms of real work experience, some employees will become jealous if they feel they deserve a position higher in hierarchy and they don't receive it. They may even become non-compliant with the instructions from their, boss. Mintzberg's power game is defined by a series of behaviors and situations associated with internal and external groups attempting to control the organization's actions and goals. According to the article Challenging the Balance of Power, Patient Empowerment, the shift of power is actually going towards patients. This article explains that organizations are allowing patients to have more power in regards to healthcare decision making, and are now more aware of their rights. That's all I got. Thanks.